I am Dr. Sandeep Bansal, Additional Professor in the Department of Otolaryngology and Head Neck Surgery, PGIMER, Chandigarh. It's a very interesting question. Because of the change in the schedules of the people, because being off work, being at home, the sleep patterns of course have changed, and they are because of apart from being that they are not going to work, so they are sleeping late and they are getting up late. They are not setting alarms because they don't have to rush to the office. Apart from that, I think the stress of the financial burden which they might have to face, the stress of the well-being of their family, the stress of not, that fear of not contracting COVID-19, all those things have changed the quality and quantity of sleep in people. Another factor would be because of staying at home, those who take alcohol, maybe they have increased the quantity of taking alcohol because they have nothing much to do. The stress of again the financial burdens have made them take more alcohol. Alcohol might be putting them to sleep, but the quality of sleep is not good. So the sleep always remains fragmented and ultimately leads to its sequelae of anxiety, fear, not being fresh the next morning, not being physically fit, headaches, and so on and so forth. The sleep medicine, of course, has taken a big hit because of this pandemic. As such, the emergency services and the COVID services were going on in most of the hospitals. The normal routine work had been stopped. And sleep medicine is one subspecialty which has been affected the most, primarily because I think these patients have been snoring, and snoring produces a lot of aerosol. So the aerosol can, transmit the coronavirus. So all the tests, all the sleep studies which were being happening in the hospitals have been stopped because it's a closed room, soundproof rooms, the labs. So all that had taken a big hit because of the COVID pandemic. So we had to, kind of stop work for some time for the peak of that COVID-19 pandemic. See, the comorbidities would be per se would be, of course, first and foremost, I would say is the obesity. Obesity is the mother of all other comorbidities, be it diabetes, be it hypertension, be it cardiovascular disease. Everything is, I would say the core, the basic problem is the obesity, which leads to all these problems again and again. Apart from these comorbidities, I think the decrease in the immunity level of the patients, again, I would say maybe because of the stress, maybe because of lack of sleep or inadequate sleep, again, has led to decrease in immunity levels, which were, and the COVID virus being so virulent, the patients who had associated uncontrolled diabetes, the patients who had taken steroids, and especially strong doses of steroids, later on in the second wave of COVID, have been coming up with an entity called Mucor Mycosis, that is an invasive fungal disease, proved to be quite morbid and fatal also. From the ENT point of view, I think this is the most significant comorbidity which we have seen during this COVID pandemic. I think it is mucormycosis is not an entity that which has been new to us as an ENT surgeons. Being a tertiary care referral center I am working in, so we used to see about 40 to 45 patients per year of mucormycosis previously also. But during this second wave of COVID, the numbers have been just humongous. There's been so much of mucormycosis all around, and from my clinical experience, I would say the most important two factors have been hyperglycemia, that is uncontrolled diabetes, and steroids being given for treatment of COVID. Indicated, not indicated, we will not go into that, but high doses of steroids being given. So those two factors are the most important thing and the most, I would say, scientifically proven things at present, that which have led to such an increase in mucormycosis in India. So from an ENT surgeon point of view, of course, it has to be, we have to detect it as early as possible, and we have to start the treatment again as early as possible. And as early as possible, I would say immediate we need to take. The earlier we start treatment, the better prognosis it would be, because as such it's a very debilitating disease. It is a very morbid condition. So the diagnosis and starting of the medical therapy and the most urgently the surgical therapy for that in conjunction with medical therapy would help us to increase the prognosis or make the prognosis better for this disease. So now with the COVID waning, as the COVID patients are decreasing day by day, so we have opened our sleep lab again. We started doing our sleep studies, and we have even started doing our drug-induced sleep endoscopies in our operation theaters to know the level of obstruction in the patients who have been referred for, who have had a failure of CPAP therapy, medical management, or who had not tolerating medical management, who have not been, who have not improved even after lifestyle modifications and losing weight and all. So for all those patients, we have started doing our drug-induced sleep endoscopy, and we have operated 1 or 2 patients also. So I'm seeing my sleep practice back on track slowly and slowly.